You're listening to the Whittemore Community Magazine, Our Power, right here on WPGS 1330 AM on your dial. It's called Good Wednesday instead of Good Friday. I'm your co-host, Ed McQueen. The other co-host is acting as the engineer today, so.
Because of the 3-foot rule, is that what it is?
3 foot.
Okay.
3 foot rule. So we'll start today and welcoming our guests. As you all saw on Facebook and on our social media and some of the emails, our guest today is none other than Dr. Winston McIver, Jr. I didn't throw the junior in there. And he's going to talk to us today. My understanding is that he had given a preview at one of the local churches earlier about the status of and some precautions of the coronavirus, better known as COVID-19. And I'm going to ask him later on why 19, but we'll start off by welcoming you, Dr. McIver.
Thank you for having me. We can go right to the COVID-19 because of the year 2019.
Okay.
It's coronavirus 2019. So when the World Health Organization, CDC, name viruses, they typically name them based off of the family of viruses they belong to and the year that it became an issue. So that's where 19 comes from.
All right. You heard that, right? Okay. All right.
Okay. Thank you for having me. Yes, on Sunday, I did a talk at Friendship for fear of what was going to happen, did happen, where we would start having more positive cases. At that time, when I spoke at the 745 service, there were no positive cases in Horry County.
Right.
Between the 7:45 and the 11 o'clock service, there was one positive confirmed case. But the real reason why I'm talking as well as a lot of my colleagues from medical school residency, talking to try to give accurate information to what's going on here.
Right.
The other concern is that, on social media, there's a lot of things that are going around that are not necessarily factual. People are getting information from unreliable sources, and in medicine, when we give information, we give information as evidence-based as we know it at that time.
Right.
The situation with this virus is that it's a novel or a new virus. And so a lot of information is being learned as we go, as more information is being obtained. Unfortunately, as people passed away, more information is being obtained that way.
Right.
And as the countries that are involved, which right now is 160 countries and regions, provinces throughout the world that have been affected by COVID-19 at the present time.
Let me interject, or let me ask you this question. Okay, 160 countries?
160 countries.
And we have a total of another country, yeah, almost like 190, something like that, right? And then country, yeah, I'm saying that, I'm trying to make a relativity here, that let the people know how serious it is.
Well,
okay.
It's serious for a couple reasons. For number one, when it became a pandemic, and pandemic just means it's a worldwide spread,
right,
with the likelihood of more spread, more disease before it gets better.
Right.
When you think about, outbreaks of diseases, a lot of times, here most recently we were talking about Ebola, but even Ebola wasn't a pandemic.
Right.
So we're talking about something of major proportions. The other thing is that, and I don't want to get into this too much and to belabor this point too much, but we've got a late start on testing, and we still have not tested as many people as should have been tested or should be tested, and these numbers will continue to rise. Right. I'll get into that a little bit later, but the concern is that, this is something that was inevitable to happen. Pandemics do happen. As a matter of fact, just to kind of give a little brief history, there have really only been 6 pandemics in the last century.
Right.
4 of them prior to this were more airborne type pandemics. HIV/AIDS was a pandemic, was a pandemic. Its peak was around 2005 to 2013, but as far as respiratory type pandemics, there was the Hong Kong flu in 1968 that reportedly killed 1 million people. There was the Asian flu that was between 1956 and 1958 that estimated killing 2 million people, about 70,000 in the US alone. Next was the Spanish flu, which was the biggie, from 1918 to 1920, where it was estimated between 20 and 50 million people died. Estimated about 500 million people were affected, about a third of the planet's population.
Yeah.
With about a 10 to 20% mortality rate. Other pandemics, the swine flu, which originated in Mexico, about 700 million cases, and now COVID-19.
Right, was treated, wasn't it?
Well, there's no medicine to treat this. There's no cure for this right now, and there's no treatment for this. There's not even a vaccine right now.
Right.
Now, one of the companies has started some experimental vaccines for this, but again, it's too early to tell. We're probably, 6 to 9 months away from a vaccine for this, more than likely.
But people are getting the virus and they're recovering, right?
Well, yeah. I mean, the majority of people that get this will recover. Right. But the problem is you've got people that are elderly and real young that have chronic conditions such as diabetes, cancer, uncontrolled diabetes, cancer, lung problems such as asthma, emphysema, chronic bronchitis, that would be more at risk for developing this. Most of the people that are dying from this are dying from pneumonia or some type of septic type picture where their body just gets overwhelmed with infection.
As a result of having infections already.
Exactly. Having conditions already.
Yeah.
Mm-hmm.
So that just put the icing on the cake, so to speak. I hate to use the word icing, but
exactly.
But adds more to it.
Right. A little bit of background about COVID-19. Around December of 19, about 3 months ago, officials in China started reporting this mysterious type illness that were having people go to the hospital. A lot of them ended up with pneumonia. A lot of them ended up dying. And so they in turn reported to the World Health Organization, which is responsible for looking at the world health issues and making recommendations and things like that. So in January of this year, 2 months ago, the World Health Organization declared these outbreaks of this virus to be a public health emergency, an international concern.
Right.
2 months later, this month, a couple weeks ago, the World Health Organization deemed this a pandemic, that this would spread and that it would likely get worse and affect a lot of people.
2 minutes
worldwide.
That's
Worldwide.
what
Yeah. Now, there's some talk about whether, China, withheld information. Was this going on prior to this? And, again, to me, that conversation is not really important right now. The important thing is just to make sure that people understand the severity and the seriousness of this. The fact that it's a novel virus means that our bodies haven't had a chance to develop immunity to this.
Right.
So that's why people are getting sick.
So, again, I guess I'm just going to make some comparison there. As much as I can remember, this is the first time potentially the country is going to be on a lockdown.
Well, yeah, I mean that potentially can happen.
Yeah,
that could definitely happen. That could definitely happen. Now, the thing about the coronavirus is it's a fairly common virus in humans, but in humans and in animals actually, different species of animals. The common cold is a type of coronavirus, but there's different degrees and severities of it. And again, because this is something that's new, that's the concern, the major concern about it.
Before I forget, okay, by virtue of you saying that there's a type of corona. The word corona.
Right, corona has to do is for crown. It has to do with the way that the virus actually looks. When you look at the virus under a microscope, it has a characteristic look, and that's how they know what family the virus belongs to. then they have to kind of go a step further to find out, is this something that's new, something that's old, but it has a characteristic look
Right.
of the virus, and that's where it comes from.
Oh, so it just
It's Latin for ray, like sun.
Yeah.
Right.
Corona.
So it has like a crown to it.
some jokes.
Now, here's what happens. Like I said, humans have have coronaviruses. Animals have it, but very rarely does it jump from from an animal to a human.
Yeah.
We had that happen with MERS, SARS, and now COVID-19, all of which are corona-type viruses. It appears, and this is not, there's this question about it, appears that this may have come from bats. There's a researcher in China that actually has isolated this genome of viruses to bats in China. The problem is, though, is that the medical community isn't sure if bats were the main source of this, or if there was an intermediate source, so bats to another animal and then to humans. And that part is still being evaluated. But what happened was it was isolated to this market in this province in China called the Wuhan province, where they have a very exotic animal market, and they sell all kind of animals.
They eat all kinds.
And exactly, and again, what happened was the first people were found to be people that went to that market. But the problem is now you started having people who were getting this virus that didn't go to the market. So then it had to have gone from animals to humans, and then humans to humans, and that's where the problem really came from. And the World Health Organization realized that there was a major problem there when you start having people pop up who had no known contact with people who were in that market.
So, is your office open today?
Yes, yes. We were open today, and we're screening folks. The people that are calling that are having complaining of illnesses, we're getting information. My office has been trained on what questions to ask to then see if we're going to have that person come to the office, or if we're going to have that person call the numbers, whether it be MUSC's number, McLeod Health's number, Grand Strand's number, or the DHEC number, to then get further questioned and to see if they need to be tested.
So, under the governor's mandate, then I guess the doctor's office are exempt, obviously.
Yes, yes, because we still got to take care of the people that have other illnesses and conditions to make sure that we keep their health fine. Right. To make sure that diabetics whose numbers are uncontrolled, we do our best to control those, so they would be less likely to have any issues in case they did come down with it.
So, is it true that the masks aren't really doing any good?
Well, the mask, if a person is sick and they're coming to the office, the mask will help prevent it from being spread. Okay, help the virus from being spread.
But the person has to.
But if they've got COVID, they need to have an N95 mask, and that's a specific kind of mask to stop certain particles from coming
through.
Mm-hmm. So the mask is really to protect the person from the sick person.
From the sick person.
Right.
Yeah. Yeah. I just wanted to get that out there because you see everybody's wearing masks, and some people get masks just as a precautionary measure, and they really don't need it.
Right.
They really don't need it. So they're taking masks from the people who really need it.
Exactly.
Yeah, and that's what happened wrong. You'll listen to the Whittemore Community Magazine Hour right here on WPGS 1330 AM on your dial. And if you can call in with your questions, you'll talk to Dr. McIver, ask your questions, and if anything that he has said so far that you want to comment on, we certainly hope that you would do so. You might say something that could save somebody else's life. Okay, so give us a call, area code 843-248-6365 or 843-248-2890. I'm going to say those two numbers again. 843-248-6365 or 843-248-2890. Right here on WPGS 1330 AM on your dial. And we're talking with Dr. McIver, Dr. Winston McIver, Jr.
The symptoms with COVID are similar to the flu,
Right.
with the exception of, a lot of times higher fevers, but the biggest thing is more of a shortness of breath, where, unlike, You know, when people come in with the flu, they usually feel bad, achy,
Achy.
tired, run down. But with, you know, COVID-19, these people are having significant shortness of breath. And so that kind of makes it different from other viruses, including the flu. But again, this isn't a universal thing. And we're talking a little bit about what's called an asymptomatic carrier, where sometimes people may not have very many symptoms at all, but they've been exposed to people and they've tested positive.
I was told that it took about 4 days to come into play, 4 or 5 days after you come in contact.
It's thought to be anywhere between 2 to 14 days. Majority of people will start showing symptoms between 3 to 7 days.
Right.
But again, it can be up to 14 days. Talking about, you know, the severity of this, you know, when I gave the talk on Sunday morning until here most recently, the worldwide positive test went from about 150,000 to about 215,000.
Worldwide.
Positive worldwide. Right now, in United States, it went from about 2,600 positive tests to over 8,000 tests.
And if you consider a rate, that's pretty.
It's significant.
It's significant, yeah.
But here's the thing: from Sunday morning until here most recently, several hours ago, the number of people that died in the United States went from 51 to 125.
That's a terrible rate.
125. Yes, now all 50 states now have confirmed positive tests. At that time, Sunday, West Virginia was the only state that didn't have a positive test, but it was probably just because they didn't test enough people in West Virginia. But that was inevitable to have all 50 states.
Right.
New York has the most cases, about 2,500 positive cases, and right now about 16 deaths in New York State. Neighboring states for South Carolina, North Carolina has 71 cases.
Can I stop you? Now, in isolation of those deaths, more specific, and probably, is that they were ill already, you think? Or, like you just said.
Not necessarily. I mean, you know, the majority of them, I feel, probably will have what we call comorbid conditions, meaning other conditions, other chronic conditions. Right. But, you know, that's not going to be everyone. There are going to be some people that will
be healthy.
Right. Yes.
And then get it and then pass.
Yes. That won't be that. I mean, that will be probably the exception, but it can happen, and that's the mistake that people are making is because they're healthy, they can, you know, still have life as they knew it.
Right.
I mean,
you need to put that out there.
You know, yesterday looking at the news, you know, there were hundreds of people on the beach in Florida, you know, having a good time.
Having a good time, spring break.
And which is really, I think, reckless. You know, I don't know the governor of South Carolina, but I have to give the governor of South Carolina credit for taking a stand as they did yesterday, ranging from, you know, the mortgage situation, the court situation, just trying the restaurants, unfortunately, but still they can do the drive up and the carry out. But this thing has to be taken seriously. And we'll talk about, you know, we'll talk about some other stuff later about flattening the curve and social distancing. But, you know, as far as the numbers go, like I said, neighboring states, 71 cases in North Carolina. And the biggest jump statewide today has been Georgia. There's 199 cases in Georgia. And 3 deaths. No, 199 total.
Right, but what was it before?
I'm not sure on that.
You said a big jump. So
right, I think they had about 25 cases today.
To 100.
Now again, that could just be that they're testing more. So again, a lot of these states are now getting more tests, and they're still testing, but these numbers still are low compared to what the actual numbers probably are.
Probably are.
Mm-hmm. In the United States, the deaths have gone from 51 to 125 from Sunday to today. So it is definitely real, and he definitely needs to be taken to this. Now, there was definitely some talk going around about whether you know, people of color African Americans can get this, and you know, if we can get the flu, we can get this. So it's not unique to any one group of people, or any one group of people is not immune to this. This is an equal opportunity condition that can affect any and every one.
And they said, I guess they tried to calm us down a little bit, but they said that more people died of regular flu this past year. I think they mentioned something like 58,000 people.
Right. Well, you know, the problem is, again, this is a new virus. There's still a lot that's still to be learned about this virus. And the problem is that nobody has immunity to this virus. Whereas, at least from the flu cases, most people have some immunity to it. Because the viruses, you know, viruses are unique things. When I was in college, I actually studied viruses, worked with the CDC. Matter of fact, my scholarship at college was through the CDC. So I had to learn about epidemiology, which is the origin and distribution of diseases, statistics, biostatistics specifically, to learn how to understand some of these studies and things like that. So this of some sort was bound to happen as far as pandemics. I mean, if you really look at it, when I was reading, you know, and thinking about it, about, you know, every 100 years there's at least 3 to 4 pandemics of some type. But the problem is that you're talking about now a novel or a new situation that, you know, now, you know, unlike, you know, things like the Spanish flu and the Asian flu and the Hong Kong flu, we've got more international travel now. You know, we've got more of that now, so that propagates or has its spread, you know, happening the way that it's happening. Well, yeah, you know, part of the issue and that had, you know, the medical community upset was that the World Health Organization had their own test that they were sending to China, and for whatever reason, various reasons, we didn't use those tests. We were trying to develop our own test, and which took time to develop. And in the meantime, you know, people were getting sick, the disease was spreading. Again, like I said, they reported to the World Health Organization in December. We've just, 2 weeks ago, really started testing folks?
Yeah.
I mean, that's inappropriate. And so, you know, again.
Based on when we found out.
Right. So, you know, again, the World Health Organization said that this was going to be an issue in January. It's now March.
Yeah.
So, you know, the thing that, you know, most people in the medical community now, you know, we understand that was a problem. We understand that, you know, that should not have happened. Now we're trying to find ways to go through what we call flattening the curve. Okay.
Oh, flat, yeah.
Right.
Yeah.
So if you're listening on TV and you've heard people talk, there you hear about flattening the curve, flattening the curve, flattening the curve. And basically what that means is we're just trying to reduce the incidence, which is the frequency of the disease, and trying to reduce the prevalence, which is the commonness of the disease, to overall reduce the number of cases that we're having.
Yeah, I'm glad you brought that up, about flattening the curve. Because
Mhm.
they use that
Right.
a lot
Right.
on TV, and
Right.
they can't assume that everybody knows
Right.
what they mean when they say that. So I'm glad you brought that up.
Right. So what happens with flattening the curve is when you look at the number of cases over time, you're seeing this going up like a mountain. And you know at some point in time, it's going to come down. You're just trying to flatten it to get it down faster, so that way there are less cases that are popping up,
Right.
and hence less deaths.
Right.
So that's what flattening the curve really means, is trying to reduce the incidence and prevalence of the COVID-19.
We had some information that just was brought up to us, and that the question was asked in view of the fact that there are colleges and universities that are closed until April 1st.
Right.
What's the likelihood that some sort of containment will allow institutions to reopen?
My feeling is that those colleges are probably going to be opening later than April 1st, if they open again this semester. Right.
Yeah.
I know back at my alma mater at Morehouse, they've already canceled graduation and scheduled it for December. So a lot of colleges are doing that. I know Howard University is shut down because they did have one positive case on campus. And so, you know, when this happens, you have to take, you know, extreme caution and basically, you know, first do no harm.
Okay, there was a daycare center right next to your office. I was driving by that this morning. I didn't see any children out there playing, but
Right.
and the very young people are not as vulnerable as we are, right?
Correct.
That's not true.
Okay.
Yeah.
Well,
So- so
okay.
the-
Okay. I'm
so-
just going by what was
Right,
on, what was
exactly.
on the news. Yeah,
So no,
yeah,
the young and the very old, young and over 65. Let me be politically correct on that. The young, over 65, and those with chronic medical conditions
Okay.
are the ones that are most at risk.
Most
Everybody
at
is
risk.
at risk,
Everybody.
but those are the ones that are the most at risk.
So what's the likelihood that it can spread in the adult daycare community?
Oh, very. I mean, you know, in Washington State, where it had the second most cases, a lot of those cases were in nursing home facilities.
Okay.
Now, how did it get in there? I don't know. Probably somebody had to brought it in, of course. But yeah, so it's spreading that way. I think in Illinois, a number of cases that were in a nursing facility. And those people are, you know, immune. You know, their immune systems compromised, sickly folks most of the time, and prime suspects, prime targets for this to happen to. Right, because if you've been around somebody that's tested positive, then you should call the numbers that are there at the hospitals, DHEC, and let them know that, particularly if you're having symptoms, you know, particularly if you're having shortness of breath, high fevers, a chronic cough, to be tested, particularly if you've been around somebody that's been in any of those countries that, you know, have had high outbreaks. You definitely want to do that. Now, because, okay, you will.
We need to take a break, but that's probably another call also. But we're gonna take a break right now and try and make some adjustments here, and we'll be right back. You're listening to the Louisville Community Magazine Hour Power right here on WPJS 1330 AM on your dial. I'm your co-host Ed McQueen. Our special guest today, Dr. Winston McIver, and she's now our engineer just for the day, But she's our co-host, of course, Sister April Garner. So we're gonna give you the number to call again. So please give us a call. Area code 843-248-6365 or 843-248-2890. Understand we do have another caller. Okay, caller, you on the air?
This is my cousin from Charlotte. We got a call from Charlotte. So basically, Kia, it is okay to do that with some things. You want to make sure that, you know, the playground equipment, you probably wouldn't want to touch the playground equipment for fear of passing, right? And so the other thing too is it is okay to go out, but you want to do what we call social distancing, where you're basically anywhere between 5 to 6 feet away from other folks. Because basically, you know, what happens is, you know, if a person coughs or sneezes, that sneeze can travel as much as 6 feet. So that's where that comes from. But no, that is one of the things that should go out and do, is get exercise to do that. Yeah, definitely. No, it doesn't. All right. All right, baby. Okay. Good. Just a little bit more about the flattening the curve. There's different phases, and I won't go into too much detail about this, but there's a containment phase where you try to prevent the spread as much as you can. We're beyond that. That was the initial prevention. The next is the delay phase to try and slow down the peak of the new cases. And the third phase is what we call the mitigation phase, where you try to decrease the overall impact on the community with trying to reduce more cases. And that's really where we are right now, is in the mitigation phase to try to get as much information out to folks that they can try to reduce the spread of this. You know, one thing that was said is that, you know, what we do today will affect what these numbers look like 10 days to 2 weeks from now. So it's so important to understand these concepts now so we can start to try to flatten the curve to have less spread of disease.
And you were talking about the mitigation, and of course, a part of that is just making sure that people understand what they should do in terms of crowds and things of that nature right now. And of course, that brings us to some of the more practical things that people tend to do, such as Sunday church service.
Right.
And I know there are a lot of questions about whether or not it's okay to attend the Sunday church services as usual, but the CDC released the numbers as far as the number of people in a group that you should adhere to when it comes down to that. So it was 50. Did it reduce to 10?
It reduced to 10. And you know, really, out of an abundance of caution, I would not recommend being in groups definitely of more than 20, but probably more 10, but definitely 20. Again, you want to avoid the large crowds. Other things we're talking about really prevention right now is really kind of, you know, making sure you wash your hands for at least 30 seconds with soap and hot water. At least 30 seconds.
Sing the chorus to your favorite gospel song. You'll be all right.
There you go. There you go. You want to keep your hands away from your face, mouth, and nose because those are places where it can live on the skin. The other thing is like I was saying the other day, there's a big run on hand sanitizer. Purell's making a killing right now. But you want to make sure that hand sanitizer has at least 60% alcohol. There's some knockoffs that have 30%, 40%, 50%. But you want to make sure that it has at least 60% alcohol. Other things you can do for prevention is try to, basically take care of yourself. Eat well-balanced meals. Take your medicines as prescribed by your physicians. Again, if you have a chronic condition, you definitely need to make sure that you're taking your medicines and taking care of yourself. Multivitamins, proper rest, reduce your stress. Those things can help, and they can help your immune system. Getting to the churches, I know in our community, it's a big thing to hold hands. Like I said in church and when I gave the talk the other day, right now, don't hold anybody's hand. Don't hold anybody's hand. And even fist pumping, keep that to a minimum. You probably need to do more elbow bumping.
Let's demonstrate the elbow bump.
There you go. Elbow bumping. I also talked to the church about handling money from a lot of different people that probably should be done with gloves on. Stay at home if you're sick. Stay at home if you're sick. Again, we have to be good stewards for each other. And if you're sick, stay at home. Other thing we even talked about was communion practices. To be careful with passing the communion plate. Those viruses can get on that. There was a study that was done, and it hasn't been published yet, but it was kind of released preliminarily, and it will probably be in the New England Journal of Medicine here soon. Because the question is how long does this virus stay around? And there's a lot of different talk, and people are spreading stuff all over social media about how long this virus will stay in the air at different surfaces. And really, we didn't really know. Numbers were given, but there was a study that was done, and it was released yesterday, as a matter of fact, where they saw that it could stay in the air for about 3 hours. It can stay on copper surfaces for about 4 hours. Cardboard for about 24 hours.
Cardboard.
Plastic and stainless steel about 72 hours. We're not sure about how long it can be on clothes and fabrics, but that's still to be determined, but I'm sure it can stay on fabrics for some period of time. This has also even been found in fecal material of folks that were saved. So that's why folks that were infected. So that's the reason why washing your hands is so important. There's a question about how long it can stay in the body. Some people feel anywhere between 10 to 30 days that this could stay in the body. I think that's still to be determined, but this is something that is very, very serious, and we have to take it as such.
Absolutely. One quick question. I don't know if you were able to answer. You should be able to answer this, but I'll say that because you're the doc. Animals.
Right.
People with pets. Do they need to be concerned about anything in terms of whether or not their pets are susceptible to it, or?
Well, that's a good question, and we really don't know the answer
Okay.
to that. Certainly if it's gone from animal to human, in theory, you would think it could go from human to animal. But again, I don't think that hasn't been proven. But certainly it could cross. Viruses can sometimes do that.
Okay, all right. I want to give you the number once again. It's 843-248-2890 or 843-248-6365. Now's the time to ask your questions. We have a trusted, reputable source here, Dr. Winston D. McIver Jr. of Waccamaw Primary Care here in Conway, South Carolina. He's able to answer any of your questions. Whether he has the answer today or can do some research and pass it on, we'll certainly be able to post some more information via social media if you're on Facebook, the Whittemore Community Magazine, or the network. And we definitely will find some answers for you. I think we have a caller. Caller, you're on the air.
When you are washing your hands, 30 seconds with hot water will significantly reduce the chances of any viruses staying on your skin. We're talking about the people that are not washing their hands. I read a study the other day where it said 67% of men don't wash their hands after using the bathroom.
Wow.
Now, I don't know if that's true or not. That seemed kind of high, but again,
Are you counting little boys and young men? That's a possibility.
that's a good question. That's a good question. But no, it's really just making sure that you wash your hands, countertop surfaces, high traffic areas, places like that. Really need to be wiped down, and to cut down the risk of infection.
And that's with hot water and
Hot water and soap on your hands, but disinfectants that you would normally use at home. They're what's called social. If they're socially distancing themselves from other people, that cuts down the chances of anything being passed.
But they still need to be cautious.
They still need to be cautious, definitely.
Like I've been in the house for the past 2 days. This is the most interaction I've had, but I still need to be careful at home. Is what you're saying.
Right.
Okay. All right.
Now you're in good company.
Yeah. Absolutely. Okay.
Let me say this too. I was asked the other day, what's the best way to reduce the chances of this spreading? What's the best way to reduce the prevalence and the incidence? And it is social distancing. It's important because think about it this way. A single cough can produce 3,000 droplets. A single sneeze can produce up to 100,000 droplets. A sneeze can have a particle travel up to 100 miles per hour. Sneeze or cough can travel 6, sometimes start even up to 8 feet. And the other reason why social distance is important is because infected people without symptoms may be driving the number of cases up more than we once thought. Mm-hmm. So there's a number of people that are carriers that are asymptomatic, or that not necessarily carriers, but they're infected, but they're not really showing any symptoms. So again, social distancing is so important. Traveling should be at a minimum. Group gatherings, as we talked about earlier, less than 10 people, definitely less than 20. Mm-hmm. No sleepovers, no play dates. Use caution when you're going to the grocery store. It's safe to take a walk. It's safe to do yard work. And definitely check on elderly neighbors and family members. Yes.
I was I'm gonna ask another question, but we do have another caller. Caller, you're on the air.
And that's a good question. The thing about it is that if they're playing with people that you don't know, you don't know if those people are exhibiting any kind of symptoms, or if they've been sick. So it's better to kind of stay with people that who are not exhibiting any kind of symptoms whatsoever. Going out being with other people, you just don't know if those people have any issues going on.
Dr. McIver, I read something, and I've been seeing a lot of images circulating around social media that display the people who are most vulnerable or most susceptible to the coronavirus, such as people with diabetes and things of that nature. Is there truth to that? And if so, what are the groups that are most susceptible?
That is true. Anybody that has any kind of condition that stresses their immune system, which includes cancer, diabetes, uncontrolled diabetes, sickle cell disease, any kind of lung conditions, asthma, bronchitis, emphysema, any kind of conditions that really stress the immune system, lymphoma, leukemia, anything like that.
Okay, all right. Well, we touched upon the closings for, and some of the restaurants and bars are actually closing their dining areas and just going to take out and drive through or carry out, that type of thing. I do have some announcements as far as church services are concerned and some of the things that are being done. I do have a question. I want to get the questions in from any listeners first. If you must quarantine at home, do you have to stay in separate rooms?
Well, it depends on if the person's sick or not. If the person's exhibiting symptoms and they're sick and other people aren't, then that person should be in a separate room.
Okay. All right. Okay. Well, continue to call in and give us your questions or concerns, and of course, Dr. McIver here will answer them as best he can. Our number is 843-248-2890 or 843-248-6365. I do have some church closings to announce, and this is just service cancellations. These churches are actually, some of them will have live streams of their services, and so just want to let you know that the in-person services are canceled. So these are in-person services that are canceled. Trinity United Methodist Church in North Myrtle Beach. All AME churches per Bishop Green are now closed for in-person services. There may be some streaming of the services. Sandy Grove Baptist Church in Myrtle Beach, Bethel Seventh-day Adventist Church in Bucksport, St. Elizabeth Missionary Baptist Church in Aner has gone mobile for the next 8 weeks. They will be live streaming using Facebook to conduct 7 p.m. Wednesday night Bible study, 10 a.m. Sunday school, and 11 a.m. church services, and using free teleconferencing for those who do not have Facebook, which I think is an excellent idea. Free and Independent Apostolic Church of North Carolina, Apostle Keith Curry, will be streaming live on Facebook on Thursday at 7 p.m. and Sunday at 2 p.m. for at least the next 2 weeks, beginning tomorrow. Palmetto Missionary Baptist Church, they're going to do a Facebook Live at 11 a.m. each Sunday. And Friendship Missionary Baptist Church will do Facebook Live and YouTube Live at 8 and 11 a.m. on Sunday. So if you want to attend church, now's your chance to be a bedside Baptist, a Methodist, or AME or Apostolic, whatever you are. You can listen to the live stream of these actual church services, and an hour is certainly not enough time. Brother Edward, come over here. He made me put these gloves on, y'all. I wish y'all could see these. I'm gonna take a picture of these purple gloves. And the 3 foot rule. That's right. Here. We're practicing the 3 foot rule here in the studio. An hour's not enough time to disseminate this information and to propagate what we need to the community. But we certainly appreciate having Dr. Winston McIver of Walkmart Primary Care here to answer some questions and to help you with your concerns. Just please be careful about the information that you are sharing, and make sure that it's from a reliable source. Try not to push too much information that seems a little unreasonable, because people are already a little unnerved about what's going on. So just make sure you help to manage people's fears and concerns about the coronavirus. And by all means, use every caution that you can, everything that was explained today. Just protect yourselves. That's all we can do.
I'd like to make this announcement to all of our prospective attendees who are going to attend the appreciation event at the Church of God in Christ, Mason Temple, this Saturday, March 21st. It's been canceled, so that's the information as far as I'm concerned. As far as everybody's concerned, that it's been canceled. Is want to make sure that you know this right away. Okay.
Okay. Also want to make mention that all of the West Foundation events, the basketball and mental health seminar, basketball clinic and mental health seminar that was to happen, and the golf tournament are all canceled and will be rescheduled at a later date. And also, just to remind everyone, Horry Georgetown Technical College is closed for staff, students, and faculty. Will be closed until April the 1st. Students will not be returning to the campus at any time until further notice. There will be some online classes, and the college administration is working now to develop that plan. So just stay tuned for more information. Go to hgtc.edu so that you can get this information about when classes may resume. I think the last note that I received is that they probably won't resume this semester, but that may change. We just have to kind of, follow the developments with the coronavirus to be sure. So everyone stay safe, take care, and Dr. McIver, you have any parting words?
Well, just make sure we're good stewards and make sure that we're, protecting ourselves and, think about your fellow person, particularly the elderly. And so we can try to flatten this curve and try to get the numbers going the other way with the positive cases and deaths.
Absolutely. So everyone, thank you for listening. Thank you to all of our callers and even our listeners who didn't call in, right, Brother Evan?
Right. Their text.
Exactly. Take care and God bless.